Well, good afternoon. Earlier today, following the advice of the local health officials and the Chief Medical Officer of Health, we announced that the stay-at-home orders in the hardest-hit regions of the province will be extended for an additional 2 weeks. My friends, I've said from day one, nothing, and I mean nothing, is more important right now than keeping you and your loved ones safe. That's why I've been unwavering when it comes to supporting our local health officials. Dr. Davila, Dr. Lowe, they're on the ground, and it's my responsibility to support them, to support our municipal partners. So when they ask for more time, when Mayor Tory asks for more time, as Premier, I will listen. My friends, I know we're all tired. I know we have all sacrificed so much, but there is hope on the horizon. The federal government has assured us that the vaccines we're in desperate need of, they're on their way. And it's our job to be ready when they finally arrive, and we are ready. Under the leadership of the ministers and General Hillier, we're making steady progress. Despite the delays in the vaccine shipments, to date, over 518,000 doses have been administered in Ontario. We have administered more vaccines than any other province in Canada, many of them to our most vulnerable, who now have the protection from this awful virus. And every day, we are seeing the benefits of these efforts. The numbers of long-term care homes in outbreak, the number of active cases among residents and staff, they're all falling. Now we're preparing for phase 2. We're working with public health units across the province, setting up mass vaccination sites. I've visited some of them firsthand here in Toronto and in York Region, and I look forward to visiting more as they're stood up. It's truly remarkable what our frontline partners have been able to do. We said we'd be ready, and we will be. But we can't let our guard down now, not yet. Until vaccines are widely available, people must continue to follow public health guidelines and stay home as much as possible. And before I finish, I want to thank the federal government for the announcement on the changes to their sick pay program. They listened to our calls to strengthen the program. This is great news for workers, and it's a sign of what we can do when we all work together. Thank you, and God bless the people of Ontario. Now I'll pass it over to General Hillier.
Premier, thank you very much. And ladies and gentlemen, if there's a person in Ontario that does not know that we have been through a drought for almost a month of vaccines in Ontario, I'd be very, very surprised. We've not wasted our time while we've been in that drought with a minimal number of vaccines to use. And what we've been doing is preparing for when more arrive, which started a day and a half ago, and preparing for when larger numbers arrive in phase 2 or somewhere around the 1st of April and onwards from there. We have also been continuing with the vaccines that we have to get to those in most vulnerable circumstances and to give them the best level of protection that one vaccination or one needle can offer to them as quickly as possible. So we have gone through the long-term care homes and the high-risk retirement homes and held their long-term care facilities in Ontario, more than 626 of them. We've offered the residents and the essential caregivers and the health caregivers and the staff in most of those homes, and I say most only for the staff part. In all of those homes, we've offered the residents the opportunity to get the first needle and to be vaccinated. The uptake in the residents has been phenomenal. I think we're at about 90%, and there are some reasons why it's not complete. We've been rolling through that process in the long-term care homes and the high-risk retirement homes and the elder long-term care facilities. In the latter part of that part of the program, we could not offer, because we did not have enough vaccines, that first needle to the essential caregivers and the healthcare workers and the staff who work in the homes, and we want to come back and do that. While we've been doing that, we've also ensured that people in Ontario got their second needle when it was due. And when it was due became 35 days unless you were one of those residents or the highest risk healthcare professional. It became a 35-day gap from needle 1 to needle 2. And that gave us the opportunity to be able to keep going. Thirdly, we also continue to roll out Operation Remote Immunity, getting into the isolated fly-in only communities across Northern Ontario, particularly around the James Bay. Dr. Homer Tien in Orange and the team that he assembled have been doing that, starting with the long-term care facilities a month or so ago, just small groups of people that the medical professionals on the site actually administered, and then rolling in teams as of 3 weeks ago, 6 teams at a time to go into communities. It's been a huge success. The uptake has been much more than what we had anticipated it to be, and that's because of the leadership that's been brought to those communities by the regional chiefs and by the local leaders who people look to for advice and guidance. And because of their work, because of their preparation, because of the way the program was shaped out, the people of those communities have had incredible confidence in the vaccination program and the vaccine itself, and in some cases the vaccination uptake was around 100%. Absolutely incredible. We have administered more than 8,500 vaccines in that program, and we continue with it. And next week we start with second needles in that program, and that's a wonderful thing, and we're all proud of it. As I mentioned, we did extend the interval between needles to 35 days. We can go up to 42, but we wanted to stick at 35 in case we had another disruption in the flow itself. So we were busy while we still had that drought. We will continue now. As of this week forward here, we'll continue to go now back through the long-term care homes, high-risk retirement homes, and the elder care facilities, getting the second needle to those residents, getting the second needle to the staff who have already had the first one, and getting the first needle to the staff if they did not receive the first one, and giving them that opportunity to take it. We will start and restart, and in fact we already have, as of yesterday, getting the opportunity to vaccinate those patient-facing, and that's how I would describe it, patient-facing healthcare professionals who put themselves at risk because they are in contact with COVID-19 patients, and obviously they run a higher risk of contracting COVID and then being able to transmit it to others. Clearly that's not what any of us want. And also we will start now to look at the First Nations populations and communities in Southern Ontario, and Deputy Jean-Baptiste with his table and the leadership of the regional chiefs and others have brought together a stratification of those communities and let us know which ones are the highest priority to vaccinate, and we will start now as soon as we possibly can here in this next days, vaccinating those communities and vaccinating the elders in the other communities across Ontario. And then through March, we will continue with those things as more vaccines arrive. And I just say to you that on Wednesday, 155,000 doses of Pfizer arrive. Next week, we'll get about 180,000 doses of Pfizer, and we will get down a lot, actually. Moderna reduced from what we anticipated at 90,000. Next week, we will receive 47,000, and we will use that for second needles in many arms and then get into as many new arms as we possibly can. As we roll into March, we'll continue with those programs, but one of the things we really want to do is pull the age 80 and over group forward into March. We don't think we can get at it right in the first week or 10 days of March, but by the middle of March, we want to be able to start vaccinating those 80 years of age and older, and we will be reaching out to them in the next week to 2 weeks to tell them when their opportunity is going to become available, where they can go to book their appointments, either online or through a phone line, and where they can get their information. We'll be sending them a card out to let them know what to do, and I would encourage church groups, community groups, family members, wrap yourselves around. If you have somebody in your family or in your community or in your group, in your church who's 80 years old or older, wrap yourself around them and help look after them and help them get the information that they need. We want to start doing that to provide that level of protection to that group who is most vulnerable, as we know, going forward. We will continue Operation Remote Immunity and finish off that to the extent that we can, but it will keep rolling for a while as we want to get those second needles into people's arms. We worked through with each of the public health units, all 34 of them, and that's the way we're going to roll out the vaccination program across Ontario through the 34 public health units, and they will work in collaboration with the hospitals in their area. They've built that collaboration. They will work with the primary caregivers, the family doctors in their region of responsibility, perhaps using those family doctors and primary caregivers to come together in one setting and to put in a mini mass vaccination sites and have their patients come to that and others and be able to do it in that efficient manner. And they will work with pharmacies in their area of responsibility, with whom we are now in discussions and planning on how we will roll out the vaccines through those pharmacies itself. We've worked with all 34 public health units. We've seen their plans. We've walked through their plans with them in a knowledge sharing sessions for almost all of them, and they are ready to go. They've got the mass vaccination sites ready to go and others, and all they need are the vaccines. As one of the medical officers of health said to me, we've got a 3M model. We're going to have mass vaccination sites, we're going to have mobile vaccination sites, and we are going to have many vaccination sites, and that's how we're going to deliver the vaccine in our public health unit to the people for which we have responsibility. And those many vaccination sites, that's those family care providers and the pharmacies and maybe a few others who will help give them the capacity to flow the vaccines through no matter how many we get. We asked each public health unit, give us your base number of 10,000 vaccinations per day. Get to 10,000 vaccinations per day. As you appreciate, some of the smaller, by population, smaller public health units, for them that would be a stretch and probably would never be needed, but we were challenging them to get to 10,000 a day. For some of the bigger population public health units like Toronto, like Ottawa, perhaps like Hamilton or Kingston or London, obviously we would ask much more, and I know that Dr. Davila with her team are looking at building the capacity of being able to do 400,000 a week or potentially even more in collaboration with all of those partners, primary caregivers, pharmacies, hospitals, and our own team itself. So our capacity at minimum will be 10,000 vaccinations per day per public health unit. We also asked them to tell us what their maximum could be, and we also asked them to tell us how long it would take to ramp up to the base of 10,000 per day, and then how long it would take to go from that base to the maximum, and we're working with them on all these things. Those public health units are ready. We're going to put over the top of them an information technology system to allow people to come online and reserve, and we're going to augment, complement, supplement that with a customer service desk where people can phone and get information, and we're going to support the public health units in that, and all that information will be coming out in this next 1 to 2 weeks, and we'll be going live during that same time frame and be able to provide the information to those 80-year-olds who I know are waiting to figure out where they can go and when to get their vaccine. We can't tell you exactly that yet, but we will be able to do that very soon. The last thing I would mention is that we're not going to list for a while yet on an Ontario site all of the mass vaccination centers or the vaccination center locations. However, many of the public health units have already done that. Toronto Public Health had a news conference last week and announced where their 9 mass vaccination centers will be, and many of the other public health units have posted that data on their websites, and therefore it is available when your turn comes down the road here. When your turn comes, you will know where to go. And I'll close there by saying we're ready to do more and do it faster, and we'd love to have more vaccines. We'd love to have a vaccine with a single dose. We'd love to be ready to roll out to give a huge level of protection to the people of Ontario. And now what we do is wait for the vaccines, and we'll get them into the arms of the people of Ontario, continuing with those in most vulnerable circumstances as quickly as we possibly can. Thank you.
We'll go to the phone line for questions. First question, please.
From Randy Rapp at CHCH TV.
Hi, Randy.
Yeah, hi. I'm wondering, there are no vaccines that can be given to people under 16 years of age. Are we going to be able to create herd immunity without vaccinating people under 16 years of age, and or are there plans to vaccinate people under 16 years of age? How are we going to handle that?
I'll hand that over to the Minister of Health.
Well, with the vaccines that have already been approved, the Pfizer and Moderna and AstraZeneca, they can't be used for people under 16, but there are other vaccines that are in the pipeline now that we hope will be approved very shortly by Health Canada that may be used for children. So we don't have anything as yet, but as you know, the world of COVID changes very quickly, and we hope that there will be a vaccine soon available that's suitable for children.
Follow-up?
Okay, and on another subject altogether, in the news lately, we've seen 7-Eleven applying for liquor license so people can drink beer and wine in their stores, not be able to carry it away. I'm just wondering, if we're going to have beer and wine in the corner stores, why don't we just do it? What's the holdup here?
Yeah, they're applied with the AGCO. I was informed about that a few days back, and they're an arm's length agency, as you know. They're going to make that request. And what really concerns me about that, and again, it's up to the AGCO. I want to help the restaurant folks. we gave the restaurant owners an opportunity to sell beer, wine, and liquor to give them a little bit of a boost. But I also believe with our administration that people have to have convenience and choice. We're the only region in the entire world that I know of, especially in North America, that you just can't walk into a retail store. Some of you can buy the beer, but our goal is to make sure we give people convenience and choice. So let's see what the AGCO says about our friends at 7-Eleven. On a note about 7-Eleven, if you're listening 7-Eleven, I want you to expand. I want you to create more jobs. You're one of the largest convenience store, along with Circle K, in the world. We need you up here. Let's start expanding, creating more jobs, more opportunities for people.
Next question.
From Matthew Bingley at Global News.
Hi, Matthew.
Hi, Premier. The province, or sorry, rather the federal government released some very alarming numbers from the modeling that they were predicting, which says that if reopening is done at all, we'll see cases just skyrocket up almost at a right angle. This is the second time that a warning like this has come with scientific data showing variants and reopening having a potential calamity for the province. And I'm just wondering why you are ignoring these warnings.
Well, I'm going to respectfully disagree. Ignoring that, Matthew, I've never, ever, and you can ask Dr. Williams, you can ask anyone on our health table, I've never, from day one, and I never will, ignore the health and science. I listen to Dr. Williams. The local folks will listen to their local medical officer. The feds will listen to their chief medical officer. But let me reassure you once again, whatever Dr. Williams has asked us to do, I have followed. I've never, ever wavered. I never will waver. I'll pass this over to the medical officer minister. Sorry, I'm calling you the medical officer now.
Well, I think it's also really important to note that we're not reopening the province. What we're doing is gradually transitioning back into the framework, and we're doing it very slowly and very cautiously, as witnessed by the action that was taken today to keep both Peel and Toronto with the stay-at-home order for another 2 weeks. We are very well aware of the variants of concern. We know that the cases can increase quickly, and that's why we're being very slow and very careful at what we're doing. And there's also the emergency brake that can be applied by the Chief Medical Officer of Health in any regions of Ontario where all of a sudden there is an exponential growth in the number of COVID cases. So we have a lot of safeguards in place to prevent that exponential growth from happening.
Follow-up?
Yeah, respectfully, you're saying that you're not reopening, but the modeling data that Ottawa is providing says that if you don't tighten up further, that even with what we have now, it will still see those cases shoot up. So I'm just wondering, Premier, the Prime Minister says that on his call with you last night, he was urging restraint. Was this data not made available to you or Dr. Williams? Because you do say that you are following his advice.
Well, I'll always follow Dr. Williams' advice, and as the Minister of Health said, that we aren't opening it up. Matthew, you're kind of misleading people. You make it sound like we're opening the doors, everyone's out there having a great old time. That's furthest from the truth. The facts are Toronto, Peel, and North Bay and Parry Sound are going to be in complete lockdown. It's as simple as that for the next couple of weeks. And if the mayors and the medical officer of health come to Dr. Williams and say we want to lock down further, we will. But if you want to compare Toronto with the northern regions that are the size of France that may have a few cases, well, you can't, with the geographical size of Ontario, the vast majority of cases right now, if you're looking, are in Toronto and in Peel, and York is not too far behind them. But again, I will always listen to health and science, and I'll never waver. We will get through this, but we have to be cautious. This variant is scary. Absolutely, it's scary. The UK variant and the Brazilian variant and the South African variant. But we're going to be super, super cautious.
Next question.
From Mark McAllister at City News.
Hi, Mark.
Thank you very much, and good afternoon, everyone. A question for both Premier Ford and perhaps General Hillier, if you can. Right now, it sounds like you're, once again, aiming very high for preparation and rolling things out, doing more as vaccines become available, and yet you're adding another demographic to phase one and therefore adding more people that will be in line for those first vaccines. What makes you so confident that it's possible to do both at the same time, have more people while trying to administer some of those limited doses?
Well, before I pass it over to General Hillier, first of all, he's done an incredible job. The whole table has done an incredible job. Everyone across the province is helping out, no matter it's public health, the hospitals, everyone is pitching in. And we've built the infrastructure up that when we have mass vaccination, we'll be upwards to 160,000 a day. And there's no one else in this entire province I trust more in an operational side than General Hillier. Let me just remind folks, he ran the NATO forces, 21 countries in Afghanistan. There's no one I trust more with logistics, no nonsense, get it done, here's our time frame, than General Hillier has shown the province. So I'll pass it over to you, General.
Premier, thank you, and thank you for the question. And no, we can't add more people in and expect to get them all done in that first phase, and that's not what we're going to be able to do. What we're doing is getting very precise. We are focused very much on patient-facing healthcare workers, and others who are not patient-facing will be a little further down the road here, a few weeks down the road, and we're going to start with the 80-year-olds, and we're not going to be able to get all of them done. There are more than 600,000 80-year-old and plus in Ontario. We've probably been able to vaccinate 10 to 12% of them because obviously many of them are in the long-term care facilities that we've already brought the vaccination program to, or the higher risk or retirement homes. Out of the 775 retirement homes, we're more than 60% complete with a vaccination program for them. So we've got some of them done. That still leaves, though, just over 500,000 80-year-old and above in Ontario that we want to be able to offer the vaccination program to. So we want to get started early. If we should get more than 100,000 done in March, that would be absolutely incredible. And if we can do more than that, that would be wonderful. But we want to get started, and we'll use the vaccines to sort of the best use to get at that most vulnerable group. We know that 80 and over have been visited tragically by COVID-19 more than any other population, and so we wanted to start at it. So we can't get them all done. We can't do everybody, and we'll continue, both our healthcare workers and the over 80, through phase one, into phase two, and it'll probably continue even a bit after that.
Follow-up?
Thank you. And a question for one of my colleagues with regard to the booking website that will eventually be rolled out. A quick question about the name. We found out that it's being called COVAX On. Does that sound like a clear title for a website that people are going to have to get to and navigate to book their vaccination?
Minister of Health, do you want that, or Sylvia?
Oh, you want to come to me?
Go ahead, General, or Sylvia. That would be great.
Thanks so much. So it will not be the Thanks so much. It will not be the only pathway for booking your vaccine. As General Hillier has already pointed out, 34 different health units have submitted their plans, and they're all very unique because, frankly, Ontario and our regions are unique. So what they've done is ensured that they are reacting and responding to their local community needs. In terms of the online portal, it is another pathway for Ontario residents to be able to get immediate information and ultimately book their appointments so that they know where the vaccination sites are in their communities, which one is the most convenient, and that's another pathway. But it is not the only pathway to allow people to get the vaccines when we're there. Thank you.
Next question.
From Holly Mackenzie-Sutter at the Canadian Press.
Hi, just
Hi, Holly.
asking about the decision to loosen some restrictions in York, but the neighboring regions are still shut down. We know variants are spreading there pretty, there's a high number of them. You said you listen to the local input and look at local health indicators, but what weight do you actually give to the regional picture and trends that might spill over if we do see people traveling from regions with higher rates and that kind of thing?
Yeah, Holly, that's an excellent question, because that's the first thing everyone asks themselves, and myself as well, if we're you know, we're butt up against York and so's Peel. You have to be cautious. And throughout this whole pandemic, we've really relied on the people of Ontario, all 14,770,000 of them, to follow the protocols and the guidelines. We're asking people, please, in the Toronto and Peel and in the North Bay region, please just stay at home. I know it's difficult. Just go out when you have to. And that's really, we can't put up roadblocks and all the rest. It's just not feasible. So again, we're relying on the people of Ontario to follow the protocols. Minister, do you want to add to that at all?
Well, it is really important for people to stay home as much as possible. This is something that has been ongoing for some time. Until we get a vast number of people vaccinated, that is going to continue to be important. So even as we're gradually transitioning back into the framework, this isn't a reopening, everything's back to normal. Not at all. Please stay in your own region. Please follow the public health measures, and sooner or later, everyone will get to that place, but we don't want people traveling between regions at this point.
Follow-up?
Yeah, and just looking at the case of York, we know that the local medical health officer did ask to be placed in the red zone, and your government, delivered on that request. So, people might argue that the regional data doesn't actually support placing them in the red zone. Isn't it kind of the province's role to look beyond kind of the local wishes if it might not be in people's best interest in terms of the pandemic?
Before I pass it over to the Minister of Health again, we really rely on people on the ground, the local medical officers. They know their area better than anyone. So do the local officials know their area better than anyone. And then they converse with the chief medical officer, and I know Dr. Williams, he's trying to cover the whole province, and he has great partnerships with all 34 medical officers. So there has to be some sort of trust in these relationships, and they've had a tremendous amount of trust with each other. So that's kind of the thought process. Then they go up to the medical officer, will go up to the chief medical officer, Dr. Williams, and then comes to cabinet. We make the final decision. I'll pass it over to the Minister of Health.
Well, Dr. Williams has frequent conversations with all of the local medical officers of health because they know what it's like on the ground in their particular area. They know where the outbreaks, if any, are. And Dr. Williams certainly relies on that information to a very large extent. But Dr. Williams and the team also looks at all of the clinical indicators. They look at, first of all, the number of cases, the rate of transmission. They look at whether the public health system in that region can deal with all of the work that they have to do for case and contact management, and the situation with respect to our healthcare system, whether our hospitals could manage the cases that they have. If there's a surge in cases, will they be overwhelmed? So while there is discussion with the local medical officers of health, there is much more that Dr. Williams and his team have to look into in terms of making recommendations to Cabinet about where certain regions should be, either staying within the stay-at-home area or moving into the framework at any point.
Last question.
From Graham Richardson at CTV Ottawa.
Hi, Graham.
Hi there. Just appreciate General Hillier's specificity on 80 plus. So if I heard you right, it's mid-March you're going to start. You hope to be done by phase 2. If I'm in my 70s or my 60s, can you ballpark, and I appreciate it's an estimate, could you ballpark when that group would be getting a shot? Are we into April and May, or do you think start of phase 2 will be enough to cover larger groups of people?
Pass that, General Hillier.
Graham, thank you for the question. No, we're not going to be into 70s or 65 and 70 or 75 and up in March, that's for sure. We're not going to get all the 80-year-olds and plus done in March. We'd love to be able to do that. We simply don't have the vaccines to do so. So yes, will it be April and May before we get into the next age brackets down and be able to get significant numbers of them vaccinated? Absolutely. It depends, all of it depends on the flow of vaccines And obviously April and May is when we start to see the bigger numbers of 2.6 or 2.7 million per month start to show, and that would allow us to move very quickly through the population base and work downwards from 80 to 75 to 70 and get those people that are in more vulnerable circumstances because of their age. But it's not going to be in March, it's going to be April and May. Yes.
Follow up?
And just on that same point, from the Prime Minister yesterday talking about 14 million Canadians by end of June, Ontario's share of that would be population-based 40%. Same question for younger people, 40s and 50s, well into summer, 40s, 50s, down into people, the 30-year-olds, well into summer, or what could you say about that, at where you stand now?
Look, I hate to speculate on those things, so just ballparking, well into summer, well into summer. The number of vaccines, unfortunately, do not support us doing it any faster. You heard the Premier say, I've talked about it numerous times in our updates about the capacity that we've helped build here in Ontario, the incredible medical system, 10,000 a day per public health unit. We'd love to have every one of the public health units, all 34 of them, working at that capacity, and the bigger population-based health units working at much more than that. We simply will not have the vaccines, I don't believe, to ever get there. And so, yeah, well into summer.
And to follow up on that, if there's 14 million, it's 5.6 million. That's a big chunk of the population that would have vaccinated. And folks, I got to kind of spin this on a positive note. I know it's in COVID, it's a lot of negativity and so on and so forth, but here's some positive things that we can think about. We still have the lowest cases per 100,000 than any region our size in North America, and even smaller regions in Canada, to the exception of the Maritimes. Those are astounding numbers, and we aren't just a little bit below them, we're a lot below them. We're seeing numbers just going right down in long-term care. We're testing upwards, and more than probably 60, I think it was 67% of all rapid tests in the country being done right here in Ontario. We're ramping up to do 1 million tests a week in different sectors, no matter if it's the automotive sector or the meat and poultry manufacturing, long-term care or education. Guys, you know something? It's tough, but man, everyone in Ontario is doing an incredible job. All you have to do is start going online and start looking at other regions, what they're facing compared to what each and every one of you have been able to accomplish. I always say I play the smallest part in this. The people of Ontario have done an incredible job. So there is light at the end of the tunnel. We will have companies up and going. And if the Prime Minister can come through with the vaccines, you go to root cause on this whole thing. Root cause. We need more vaccines. More vaccines will solve massive issues. And if he can deliver the 14 million, or at least our share, the 5.6 million, we are going to be in so much better shape, even bridging towards April, May, and June. And, I have confidence that they are going to pull through. But folks, stay positive. We've come such a long way together. So I just want to thank each and every one of you for all the great job our frontline folks have done, and even the average person there sitting at home wondering when this is over. You're playing a role as well. So thank you, folks. Have a great weekend. Stay safe, and God bless you. Thank you.
Thanks, everyone.